Hi, good afternoon. My name is Nancy and I'm a Pacific College student, and today I will be doing an assessment. This assessment today will be on Marie. She's a 25-year-old patient. She has a spinal cord injury and she has had the spinal cord injury for about 5 years. She has a wound and we will be the wound will be assessed, and she's also a chronic indwelling Foley catheter user. Okay, so hello, Marie. My name is Nancy, and I will be your nurse today. And I will be doing a physical assessment. Before I start that, I would like to, if you can identify yourself with me, please, your name and your date of birth.
My name is Marie, and my birthday is April 5th, 1993.
Okay. Do you know why you're here today?
For a wound
Treatment.
wound treatment.
Do you know what date is today?
Today is June 19th, 2018.
Okay. And do you know where you're at?
I'm at Nancy's Community Hospital.
Okay, very good. So what I'm going to start doing is I'm going to start by assessing, she's a learner rated times 4. I'm going to start by assessing her blood pressure, her temperature, heart rate, oxygen, her oxygen level. So her blood pressure right now is 120/80. Her oxygen level is 100%. Her temperature, I will also check her temperature. So her temperature right now is 98.5. Okay. So after I check her vital signs, they seem everything normal. I'm gonna start by assessing her lung sounds. So I'm gonna start her lung sounds. Okay. So what I'm gonna do today right now is I'm gonna do a physical assessment, and this consists about checking your lung sounds, bowel sounds, your skin. A note: patients with spinal cord injury are very prone to wound, or very prone to issues with bladder and bowel. They might get constipated, so they need daily bowel care. They need constant watch on their urinary um, flow. If they have a Foley catheter, if they do intermittent catheterization, that is very important. So I'm going to start by checking her lung sounds and her heart sounds and her stomach. This patient, I usually check them. They usually have a gown, and I usually check the skin while I'm doing that. So I'm gonna start by listening to her heart, lung sounds, and her heart. Okay, I'm gonna start the heart sounds. This is the heart sound. Deep breath. Okay, very good. S1 and S2, and then lung sounds. Take deep breath every time I put my stethoscope on you. Very good. Okay, relax. Deep breath again. Okay. Very good. Okay, very good. Okay. And now what I'm going to be checking, I'm also going to be checking her bowel sounds. Okay. I'm going to check your bowel sound. Listen for a whole minute. She has active bowel sounds on the 4 quadrants. Okay. And now what I'm going to be doing is I'm going to check her upper body strength. So I'm going to ask her to push against my force, pull me, and I'm also going to check radial pulses. Okay, and her radial pulses are very good. And I'm also going to check capillary refill. Very good, very good, very good. Now I'm going to check her eyesight and her mouth, and when I'm doing this, I'm also checking her skin temperature. Very good. Now I'm going to check a pupil reaction. Okay, I'm going to ask you to follow my pen light. Okay, very good. Also doing neuro assessment. I'm going to check for the pupil reaction to light. Okay, you can just look straight ahead, and very good, very I'm also going to check her mouth, her teeth, and to see if there, ask her if there's any issues when she's eating, if there's any issues when she's chewing. Okay, can you open your mouth for me? Any issues? Any issues when you're eating? There's no broken teeth. Very good. Can you smile for me? A big smile. Very, very good. Okay, from this point on, I will be checking her lung sounds when I turn her over, when I assess the wound. Okay, so now I'm gonna go down, and I'm gonna since I see a Foley catheter, I will make sure to educate her and ask her, do you know when the Foley catheter was changed? Do you know how often it has to be changed? And she will let me know every week to every month. And I will ask her about, does she know about urinary tract infection and what are the symptoms for her, like temperature, if she gets like a temperature, if she sees the urine that is cloudy, we have to monitor that so we can prevent a urinary tract infection. The next thing we do is I assess her skin at this moment. I'm also gonna check her pedal pulses. So I check her pedal pulses. Very good, very good. She has good pedal pulses, and patients that are spinal cord injury usually are very prone to wounds on their heels. So I will make sure to educate her or ask if about her knowledge regarding turning and making sure that her heels are always elevated to prevent a wound. Now I'm gonna put her head down, and putting her head down, I wanna check her bottom, because patients that are spinal cord injury usually get wounds, so usually on their bottom, ischial wounds, coccygeal wounds, heel wounds. So I'm going to turn her to the side at this moment. Okay, so I'm going to turn you to the side. I want her to be in a comfortable position. Very good. So I will check her lung sounds too. Okay. Okay, deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, very good. And I have a better view of her bottom at this instant. So I will do this turn the same on the other side, because patients usually get wounds on the bottom or on the ischial. So I'm looking here there at this wound that she has. So she has, in every time a new patient comes with a wound that there's spinal cord injury, the first thing we do is we assess the wound, we take a picture of the wound, we measure the wounds, and we let the doctor know about the patient, about their wounds, so they can let us know about any treatments or any changes in the treatment that needs to be done. So okay, turn the patient over here, and for this patient, usually we always say, is there any pain that you have? Is there any discomfort? And a lot of the patients that have spinal cord injury, they're also prone to depression. So I will make sure to do my depression screening. Side note, for a lot of the spinal cord injury patients, they're very... 2. Autonomic dysreflexia, a condition occurring on a spinal cord injury patient above the T6 level. It is related to a disconnection between the body below the injury level and control mechanism for blood pressure and heart rate, causing dangerous blood pressure levels, usually caused by full bladder, if the colon has not been empty, or the patient is constipated. And that is all on my physical assessment on a spinal cord injury patient. Thank you for your time.